If a bottle says Echinacea supports immunity, what should I actually hear? Fewer colds, shorter colds, or just a nice botanical story?
Here, possible modest help, not a force field. Across immune health supplement trials, reviewers see hints of benefit, but not enough consistency for firm blanket claims. In a 2025 pediatric meta-analysis of Echinacea purpurea, upper respiratory infection incidence fell with a relative risk of 0.81, and treatment duration was modestly shorter. But the authors also stressed heterogeneity, product diversity, and possible publication bias. So the practical answer is some products in some settings may help a little. The category as a whole is not proven magic. The first trap is treating Echinacea like one molecule. Trials and products may use Echinacea purpurea, angustifolia, or pallida, roots, leaves, or flowers, pressed juice, extracts, capsules, or combinations. Those plant parts carry different mixtures, including alkamides and caffeic acid derivatives in the broader literature. That means a positive trial is not a coupon for every tea, gummy, or tincture with a coneflower on the label.
When people say it modulates immunity, is that just softer language than boosts, or is there a real physiology idea behind it?
The physiology idea is local timing. Cold viruses first meet the nose and throat lining. Then innate immune signaling drives congestion, sore throat, mucus, and fatigue. A plausible Echinacea effect would be nudging early immune signaling or inflammatory tone, not directly replacing antibodies or antivirals. That is why trials measure practical endpoints. Did fewer people get sick? Did symptoms resolve faster? And did complications or antibiotic use change?
So if someone is deciding in October, should they think of Echinacea as a prevention habit, or something to start at the first scratchy throat?
Prevention evidence is mixed. An overview of Cochrane reviews on influenza prevention listed Echinacea as probably beneficial, but the strongest evidence in that analysis favored vaccines and garlic, and none of the interventions reduced hospitalization. For common winter respiratory infections, a prevention signal may exist, but it is nowhere near the reliability of vaccination for influenza or basic exposure control like hand hygiene and staying home when febrile. The 2025 child-focused review is interesting because it separated upper respiratory infections from otitis media. For URTI, purpurea was associated with shorter treatment duration, fewer episodes, and less antibiotic use. For otitis media, episodes were lower, with a relative risk of 0.56, but treatment duration was not significantly shortened. That makes biological sense. Middle ear infections can involve bacteria and sometimes need antibiotics, so Echinacea should not be framed as a rescue treatment.
If the child data sound positive, why not just give it to every kid with a cold? Where is the caution line?
For adults who still want to try it, I would not shop by the loudest immune claim. I would look for the exact species, plant part, extract type, dose per serving, and third-party quality testing when available. Dietary supplements sold online or in stores can differ from products studied in trials, and they're not approved like drugs for proving disease treatment before sale. Product identity is part of the evidence, not a boring label detail.
What would a fair self-test look like? People remember the one cold that ended quickly, but winter illnesses are noisy.
One result that catches attention is lower antibiotic use in the pediatric URTI meta-analysis. But that does not mean Echinacea is an antibiotic, and it does not mean antibiotics are never needed. It could reflect fewer episodes, milder courses, prescribing behavior, or trial context. The decision cue is simple. Echinacea, if used, belongs upstream as a possible symptom course modifier, while bacterial complications still need standard evaluation.
I have also seen Echinacea pitched to athletes for oxygen capacity. Is that a separate win, or an example of stretching the immune story too far?
The biggest pause flags are allergy and immune system complexity. Echinacea is in the daisy family, so people with related plant allergies should be cautious. Reviews also flag autoimmune disease as a situation where immune-modulating supplements deserve clinician input rather than casual experimentation. Add pregnancy, breastfeeding, liver concerns, complex medication lists, or upcoming surgery, and the decision shift from try a bottle to ask before using.
What about the headline that Echinacea is as effective as Tamiflu for flu? That sounds like the kind of claim that could change behavior fast.
Exactly. The red line is severity or vulnerability. If someone has shortness of breath, chest pain, dehydration, persistent high fever, severe ear pain, worsening symptoms, immune suppression, pregnancy, very young age, older age with comorbidities, or high-risk influenza exposure, supplement should not be the plan. Echinacea is a maybe small adjunct for ordinary respiratory infections, not a triage system, and not a reason to delay testing or treatment. My decision rule is narrow. If you are generally healthy, not in a caution group, and you choose a well-identified product similar to studied preparations, Echinacea may be reasonable to trial for winter upper respiratory infections with modest expectations. Judge it by fewer episodes or slightly shorter symptom time, not by feeling invincible. If the product is vague, the claim is dramatic, or the illness is severe, the evidence is no longer carrying that use.